So without further ado, I think we'll pass the floor to our speaker.
So good morning. So welcome to our CPR session today. So this is the tentative for today. So we're going to start the ice breaking. Then we're going to start the lecture. After the lecture, we're going to around 15 to 45 minutes break. And after that, we're going to continue the demo session. After the demo session, the AED representative will do it also. They will give us the lecture. How to use the AED. And we will end our session with around half around an hour. So before that, any of you perform CPR before? Or anyone perform CPR in front of you? No. So everyone is first time. So just we're going to go. First is the principal causes of death in Malaysia in 2023. So for the first time in 2 decades, pneumonia supersedes the ischemic heart disease as the primary causes of death in Malaysia. So for information, pneumonia is an infection of the lung. The reason pneumonia is the primary cause in last 2023 because of the post-COVID pandemic effect. And then the second causes is the ischemic heart disease. So ischemic heart disease means the narrowing of the heart, coronary of the heart. The heart muscle cannot get enough blood supply, they will lead to the ischemic heart disease. And it's followed by cerebrovascular disease, means stroke, accident, and the last one is the cancer of the lung. And so let's see the breakdown according to the gender and also the ethnic group. So most of the death among the male is because of the ischemic heart disease, while for the female is the pneumonia. So basically, male have a higher risk to get the ischemic heart disease compared to the female because of the hormone. And for after menopause, the female have higher risk to get the ischemic heart disease because of the hormone known as estrogen. The estrogen will reduce after the female after menopause. And for the ethnic group, the majority of the Chinese cause of death is because of pneumonia, while for the Malay and Indian is the ischemic heart disease. And among the three major groups, because of the genetic factor, Indian is more prone to get the ischemic heart disease compared to the Chinese and also the Malay. So far, any question?
Why is it that now?
It's a genetic factor. They do research and they found that Asian Indian is more prone to get the. They did a study because of the genetic.
It's not lifestyle.
Lifestyle also got. So we go to the next slide. Sorry, another slide first. So according to the age group, most of the ischemic heart disease is among 40 to 41 to 59 years old. But nowadays, even younger people can get heart attack because of the lifestyle, smoking, everything. So this is the one. We have few risk factors for the ischemic heart disease. We can divide into non-modifiable and modifiable. So non-modifiable is something that we cannot change. Age. As you grow older, the risk is higher. You cannot grow younger, right? You can grow older. And for the gender, as said before, male is more prone to get the heart disease. Genetic factor, as race means certain people, Indian is more at high risk to get the heart disease. And genetic factor, even though let's say it's Chinese or Malay, they have a strong family history of heart disease, they also have high risk to get the heart disease. And for the modifiable risk factor, it's the lifestyle we can change it. For example, high blood pressure, diabetes, we can change our eating habit. Try not to eat too much junk, eat healthier, less salt, less sweet. And for the smoking, of course, you have to stop smoking. And physical inactivity, obesity, and also obesity. This one we need to do more exercise so that we not reduce our weight. And also high blood cholesterol, of course, our eating habit. Okay, so this one, like for example, gender, even though we can do surgery to change our gender, but we still genetically we still male or female syndrome. Just the appearance we can change only. Okay. So far okay, right? And so what's the difference between cardiac arrest and heart attack? So heart attack is like in Malay it calls serangan jantung. Cardiac arrest means the heart stop. So cardiac arrest is happen when the heart malfunction and suddenly stop is when the blood flow to the heart is blocked. So it will lead to the heart attack. So the signs and symptoms including chest pain, shortness of breath, sweating, tightness in chest, and also feeling heartburn, indigestion. So this one, sometimes the victim will confuse, really they will feel heartburn, they will assume it's gastric. Actually, they is having heart attack. Even we got a silent heart attack, they feel nothing, maybe after few weeks they just go to see doctor, anything we can based on ECG, then we can see that he or she did have heart attack before. Based on the ECG, we can see got some changes in the ECG. So basically, heart attack can lead to cardiac arrest. So other causes that can lead to cardiac arrest including like infection, congenital heart disease means heart disease in bone, they got some heart disease. Okay, so cardiac arrest is the electrical problem. Heart attack is like a plumbing problem. So actually cardiac arrest can happen around the world, can be happen to anyone around you, beside you, next minute, you never know. So unfortunately in this news, badminton player 17 years old passed away during a match. He can seem very healthy, right, but we never know inside what happened to his heart. And for this one, drowning girl survived after 5 minutes of resuscitation. So before that, you guys, it's good for you to take first step to learn the CPR. So even in Malaysia, there are a lot of cardiac arrest in Malaysia. All the artists pass away, and this one even a 16-year-old passed away because they have a congenital heart disease. It's a perforated heart. It leads to cardiac arrest. Yes. So it's not like 100% when you perform CPR, the victim will survive. But at least we do something instead of looking the victim pass away in front of us. And then we do CPR, so we call 999 and we'll hand the patient to the ambulance, the professional. While we're waiting for the patient and we're waiting for the ambulance, we can do the CPR. So a research showed that the median time from the heart attack to the call, the 999 in Malaysia is around 20 minutes. And from the call until the ambulance arrives is 17 minutes. So it's total around 37 minutes, 40 minutes before the ambulance arrives. So we're waiting for that 40 minutes. We still can do something, for example, do the CPR. And the research also showed that for the bystander CPR rate in Malaysia is 38%. It's slightly lower compared to other countries. For example, Korea, if I'm mistaken, is around 45, something like that. Because the awareness in Malaysia is slightly lower. So what is CPR? Cardiopulmonary resuscitation. Cardio means heart, pulmonary means the lung. So you want to resuscitate the lung and also the heart. It's a temporary takeover the function of your heart and lung when your heart stops beating. So it's a life-saving technique in the emergency situation. You can perform CPR when you're breathing and your heartbeat stops. It involves the inflation of the lung and also compression of the heart. But because this session is hand-only CPR, so we just focus on the compression of the heart. So we just will give briefing time later regarding the inflation of the heart technique, how to give the blow. So the objective of the CPR is to keep the brain alive and also to prevent the biological death. So basically, there are two types of death. The clinical death and the biological death. Clinical death is the first 4 minutes once you're breathing and the heartbeat stops. So we can still do something within the 4 minutes to revive the patient. For example, CPR or any medical treatment. So for the layman, you can do CPR. So after 4 minutes onward will be the biological death. So the brain cell will start to die, so it's irreversible, it will cause irreversible damage to the lung and also to the brain and all the other organs. Okay? When do we start CPR? So far, any question? No question, right? So when do we start CPR? So 3 conditions must be, they must meet these 3 conditions for us to start the CPR. First, the victim must be unconscious, no pulse, means the heart stop beating, and also no breathing. So let's say some people lying down there, you have to make sure he or she is unconscious. If he or she is sleeping, don't do CPR on the victim. So hands-only CPR, first step is danger D. So make sure the scene is danger for you and also the victim. So let's say that we saw a patient, victim collapsed in the middle of the road because of accident. So you have to pull the patient to the side before you perform the CPR. You're not going to perform the CPR in the middle of the road, in the middle of highway, right? It will be cause danger to you and also the patient also. So you ensure the scene area is safe and free from hazard before we continue to do the CPR. Next is response. So how we check for response? We're going to tap on the shoulder, louder, ask the patient, are you okay? So if he's asleep, then he can wake up properly. So C is compression. So after make sure no pulse, no breathing, we can check our pulse. This one is called cardiac pulse. After make sure the patient victim no response, we can check for pulse. You can feel your pulse, place 2 or 3 fingers from the center slide to the side. You can feel your pulse over here. You guys feel the pulse? Okay, so the recommended time is like 5 to 10 seconds. Let's say you cannot feel the pulse or you don't know whether it's there or not, you can start to do the CPR. Because we cannot delay starting the CPR. So within 10 seconds, you're not sure you just start the CPR. Make sure you got no pulse, also no breathing. How to check for breathing? You just see whether any chest rise of the breathing. So no pulse, no breathing, we will call for help. So we'll call 999. If you are alone, you can just use your headphone call, or if someone around, just use your CPR direction, call 999 and get it in. And then we're going to compress in the center of the heart. Remember, push hard and push fast. So in medical term, actually here we got a bone called sternum bone, somewhere here. So supposedly you need to put your hand at the lower half of the sternum. But it's easier for you to remember, just compress in the center of the chest. Okay. The technique we're going to teach later in the practical session. So CPR.
Yes.
So CPR is easy as CAB. So C is compression, A airway, B breathing. So we're going to focus on the compression. Airway and breathing, we're going to open the airway and give blow. If the victim is someone you know, you want to give the blow, it's okay. Let's say it's the victim is someone you don't know, even you don't know patient has got any COVID or anything, you can just focus on compression. The NHAM also recommend hand-only CPR for language. Because sometimes when we give blow, if you are not trained, maybe we'll give the blow incorrectly. Maybe we'll over-inflate the lung. So you just focus on the compression. So early chest compression can immediately circulate the oxygen that's in the bloodstream. Okay. And so the recommended depth, this is for the adult. For the recommended depth of the compression is 5 to 6 cm. The rate is 100 to 120 compression per minute. So technically, in real life, not going to measure is this 5 or 6 cm, right? So you just press on it. So even when you hear crack, you just continue to press. And it's possible you can cause the rib to crack, but you have to set the life first. All the crack, all the other side effect, the complication, we can settle it later. If the patient dies, also no use, right? The crack also nothing to do. So the rate 100 to 120, right? When I'm going to take the next slide. So because it's 4 participants, any volunteers, we're going to do some demonstration.
Yeah, very simple. Yeah. Yeah. Thank you.
1 and 2 here.